Hi, my name is Megan, and I have created a presentation on bronchitis for you. Here's an overview of bronchitis. To break down the word, bronch is referring to the bronchial tubes, and more specifically, the lining of them. Itis is referring to inflammation. So essentially, inflammation of the bronchial tubes. There are two types, acute and chronic. Acute is also known as the chest cold, which usually improves on its own in 7 to 10 days. Bronchitis generally develops from a cold or another respiratory infection. Chronic bronchitis is a condition included in COPD, is defined by repeated bouts of bronchitis and a productive cough that lasts at least 3 months. The causes of chronic bronchitis are most commonly attributed to cigarette smoking, but can also be caused by air pollution or toxic gases in the environment. Acute bronchitis is generally caused by viruses similar to those that cause the flu and cold, so antibiotics are not useful in the treatment of bronchitis. Symptoms are generally the same for acute and chronic. They include cough, production of sputum, fatigue, shortness of breath, slight fever and chills, chest discomfort, mild body aches, and/or a sore throat. Times you should seek medical care for bronchitis are: if you have a temperature of 100.4 degrees Fahrenheit or higher, if you have a cough with bloody mucus, if you have symptoms that last more than 3 weeks, or if you have repeated episodes of bronchitis, which could suggest chronic bronchitis or COPD. Treating acute bronchitis. Their treatment of acute bronchitis includes over-the-counter medications such as cough and cold medicines or pain relievers. Some at-home remedies that can be used include rest, fluids, the use of a humidifier, nasal spray, breathing steam, using lozenges, or using honey to treat cough. For the management of chronic bronchitis, the goal is to relieve symptoms, prevent complications, and slow the progression of chronic bronchitis. Non-pharmacological interventions include smoking cessation and pulmonary rehabilitation. Pharmacological interventions include bronchodilators, which is a drug that widens the bronchi, making it easier to breathe, or glucocorticoids, which are a type of hormone that can reduce inflammation. So this is helpful in the treatment of inflamed bronchial tubes. Preventing bronchitis. Ways to prevent bronchitis is quitting smoking or continuing to not smoke, avoiding secondhand smoke, getting a seasonal flu vaccine every year, covering your mouth and nose when coughing or sneezing, and washing your hands. Here are my sources, and thank you for listening.